Any private practice has a lot of stuff to get done. You've always needed people, and automation is a more recent option, one met with both excitement and skepticism. Every so often, any practice owner should look at their practice and ask, is this optimized or not? And my guest today helps her clients look at their people and automation and a bunch of other stuff as well. And she's got some ideas for us. I'm Carl White, principal at Mark Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. Usually that's what they want, and care is better when the provider owns the practice because that's when they're going to have the most freedom to make the clinical decisions that they think are best. It's just not always the same when somebody else owns the practice. Whoever that might be, their agenda can get into the provider's ear. It's more for the provider to think about. Let's just keep it simple and try to keep it private. My guest today is Joelene Gioulis. Joelene believes in a world where everyone's dreams of success are attainable, As a business strategist who has studied in business and leadership for over 20 years, Joelene brings a unique skill of innovative and resourceful strategies to help leaders and companies grow to the next level. She has a proven executive management track record with a wealth of knowledge and success in streamlining operations for maximum efficiencies and optimization, strategic solutions for growth, risk mitigation, change management, and human resources. That's a lot that you've got going on, Joelene. Thanks for carving out some time to come on Practice Care.
Absolutely. Thanks for having me.
Yeah, absolutely. And this is a topic you can't throw a ball without hitting the word automation in some way or another. So it's going to be not even far. So I've been looking forward to this episode. But first, I want to start where I start with every guest. Listeners know where I'm going. That bio was short that I just read, but that's what I asked for. So fill in some of the gaps. Just help us get to know you a bit better.
Sure. I got into business years ago and several years ago ended up running a healthcare practice myself as a CEO and grew the practice to a sellable point and decided that I really wanted to be able to help more practice owners at a wider scale. So I got into consulting, and so now I work with practice owners on any of the challenges that they may have within their practice, which many of them are very similar. So
Yes, there
and
is some
people in
overlap.
automation, yeah, people are part of my passion.
Mhm.
And so automation, I believe, automating what we can and using our people to create a great patient experience is really where it's at.
Got it. What type of practice were you with?
I've been with a couple different practices, but the practice that I was with specialized in podiatry, but we also did physical therapy.
Okay, excellent.
Mhm.
And how long were you
Yeah.
with them?
Oh, about 9 years.
So you saw it all.
Yeah.
Yeah, that's
From
plenty of time to see it all.
a baby company with a few doctors to several offices and
Wow.
several employees. Yeah.
Wow. And then so
It was
excellent.
great. It was
Yeah.
it was a great experience. Yeah.
Yeah. Excellent. All right. So let's get into it. People in automation. So I want to start with what you're seeing with automation, particularly what you're seeing with automations in private practice that you think is exciting and why you think that.
Well, what I think is really exciting about automation is that with technology today, there's so much that we can automate that we don't necessarily recognize that we can
Hmm.
automate. And I think that by really utilizing that and maximizing that as a resource, it allows our staff members to be able to really create this great patient experience and give the undivided attention to patients. You hear a lot of um, sometimes patient feedback in some of the bigger organizations that they just feel like a number, or
Hmm.
they don't feel like they're seeing a different doctor all the time, or they're not really given, does this person even know me? We're
Hmm.
talking about healthcare here. This is
Hmm.
my body, my health, my future. And so I think that by embracing automation, it really allows us to be able to put the focus back on the patient, which is where it should be, instead of all the administrative burdens that continually come down to the healthcare
Yeah.
regulations. And so the administrative burdens just become more and more all the time. So I think embracing automation is a must to be able to really create a great patient experience, as well as invest in our staff and not create burnout.
Right. Are there any parts like I was thinking about my own experience, has the administrative burden in totality from the practice side, which is really hard for me to see, has it gotten better or worse? it's hard. If I guess if I had to place a bet, I'd say maybe it's gotten a bit worse just because it seems like the regulatory scope has probably gone up over the past 5, 10 years. Would you say?
Yeah, well, what I would say is the unique private practice in healthcare is a business, just like any other
Hmm.
business out there.
Hmm.
And I think the unique thing about healthcare is that you not just have your business regulations, your HR regulations, all the rules and regulations that you have to follow to be in compliance to run a business.
Hmm.
You also have this healthcare compliance component and this Medicare compliance component.
Yeah.
And unfortunately, I would say, yeah, more so on the Medicare side. They seem to require more and more every year, and it
Hmm.
takes away from being able to really care for the patient on the scale that I think we would like to be able to. Doctors get into being doctors because they want to help people.
Hmm.
And so when they're bogged down with a bunch of paperwork and checking the boxes, it makes it difficult to be
Hmm.
able to do that. So yeah, I would say that it's increased a bit. And then of course, you have HR regulations that are
Right.
constantly changing.
Right.
So
So are there any particular areas like with maybe within the administrative side of the practice that you're seeing like specific examples that you're saying, wow, this looks really exciting. I think this is great.
you mean with new technology?
Yeah. Well, it doesn't even have to necessarily be new. Sometimes things are awesome and they're not new. They're just not that well known,
Oh,
you know?
yes, most definitely. One of the most common things I see is that practices are not maximizing the capabilities of their EHR system. And
Okay.
so their EHR system generally is much more capable of, or is capable of doing much more than they're actually
Mm,
utilizing. So we still have some paper processes going on, and we still have some, processes that are taking 7 steps that could take 2 if we were maximizing the system. So that's one of the things when I do an assessment, I look at,
hmm.
with the technology and automation that's being used, how
Hmm.
much of is it, how much of it is actually being maximized to the capacity that that software is able to do.
Yeah. That's interesting. I mean, like I think of one doctor I go to where I doubt this is EHR specific, but it's an automation. It's just the check-in process, right? So it's an app and I go through it. And the thing that I like about it the most is that when I've answered a question before, it populates my answer, like name. Some of them say, fill out your name. I'm like, I've been here a
Yeah,
decade. Like, can't you fill that, these, so one, it's like, you get it, it's just, why do I have to
right.
type this again? Yeah, but I think it's just a separate app. I'm not exactly sure, but I
Mhm.
imagine that there's a lot of repetitive information that just has to be asked. This is repeating to say it, but over and over again, where couldn't you just grab it and, maybe if my name changed, I'd have to fill it in, but change it, but, but that never happens, right? So, is that kind of an example of what you're talking about?
Well, more so in the aspect of, a lot of the EHR systems out there are able to do scheduling online that people are not necessarily taking
Hmm.
advantage of, or do express check-in where the patient
Hmm.
checks themselves in that they may not be utilizing. Some of the abilities to actually do email reminders or text reminders. A lot of
Hmm.
people are not necessarily using that. They're still doing a lot of old-fashioned phone calls. And, one of the
Yeah.
things that I find interesting
I
is
don't
that
like those
research,
as the patient. I just, because if I don't pick now, I got to call you back. At least I
right?
think I do. I don't know. Yeah.
Yeah,
Yeah.
exactly. And so one of the interesting, research statistics that I've read in the last couple of years is that 89% of Americans are not answering their phone.
Yes.
So,
It's
you
true.
spend this
It's
staff
such a
time
pain. It used to be the thing. Like, I hope they call. Now you're like, I
right.
don't want to call. Yeah. Yeah. It's true.
But over 90% of people will check their text messages in a timely manner, right? And
Hmm.
I think part of that on the, on the patient side is it's convenient, you're working, you're doing something, you can get to it when you can, whereas a phone call is like now, or like you said, then you got to call them back. So now you have a staff member that's spending all this time making phone calls, leaving voicemails,
Yeah.
and then the patient has to call back, and
Yeah.
then they're maybe put on hold, and that, I mean, it just creates this convoluted process that isn't necessary.
Yeah. Yeah. And I don't want to go down this path, but you mentioned almost in passing. I mean, process X has 7 steps. Do we need every one of those 7 steps? And if anybody's read the biography of Elon Musk, this is like the best example I've seen. He would just ruthlessly go through and he'd watch, the production floor of a Tesla or of a rocket. Why are we
Mhm.
doing that? And unless they could justify it, it was gone. And it was great. I mean, he's sort of a personality about it. But yeah, looking at processes and just saying, why do we do it this way? Do we need all those steps? Um, the other thing that he did is he would say, who's the person? Why is that step there? Well, quality wants it. No, no, no. I want the name of the person who put it in so we can ask that
Mhm.
person. And 99 times out of 100, that person didn't have a good reason why it should be there. So again, not the focus of what we're talking about today, but you want to make things more efficient. Look at every step you're doing on something. Go, do we really need to do that? And half the time you don't. And
Right.
you could just get rid of
Well,
it.
and I think a lot of times in what I see in private practices is a lot of them have been established for a long time. They're
Hmm.
doing things the way they've always done things.
Hmm.
And so embracing technology sometimes can be scary.
Yeah.
Going through the process of change can be scary at times.
Yep.
Um, but I think that, with all the regulations and the requirements coming down, you know,
Hmm.
you you're really not going to be able, and the reimbursement rates are not
They're not
catching up
skyrocketing,
to
are they? Yeah.
they're not catching up to inflation. So in order to actually have a thriving practice, it's one of the things that I think everybody's going to have to embrace at some point.
Yeah.
Um, yeah.
I think that's right. Are there any automations out there that you're seeing that just kind of worry you for private practice?
I mean, I wouldn't say necessarily that I'm worried at this point.
Hmm.
I mean, it'll be interesting to see how AI is used in the future and what that
Hmm.
looks like. And I think there's always that, you know, toss up of, is this going to be a better thing than a not good thing? I
Hmm.
personally think that, it's probably going to be a good thing, especially in the healthcare realm.
Hmm.
But obviously, I don't have a crystal ball, so
Yes. Yes. It's a lot easier to
we'll
look into the
see.
future. I know, and just to have this, when the robots take over, when they become smarter than us, when they become aware in the Terminator series, and then they don't like what they've just become aware of and they take matters into their own
Hmm.
hands. Yes, those are those are the more common, I guess, doomsday scenarios. Um, Let me go back a bit. I mean, we talked about, look into your EHR, try to get more out of your EHR than you are today. What are some other areas where you see, you know, automation in private practice that you think this is good, this is positive, just like some examples that you see?
Oh my goodness, there's so much out there. I mean, a lot of the things that I am fans of is, I mean, from the any business concept is an HRAS system, I think is necessary, which is
Hmm.
your human resources information system to keep
Hmm.
everything in one place. But as far as the practice side goes, um, I mean, you have financial clearance software now that can keep you off the phone with insurance payers that takes an endless amount of time
Hmm.
and isn't always accurate information. There's the, text and email form. There's surveys that can be sent to patients for quality aspect. There's the EHR systems. Obviously, each EHR system has their own capabilities, but being able to have that patient portal and
Hmm.
communicate with patients back and forth,
Hmm.
through that aspect rather than sitting on the phone or having to play the telephone tag.
Hmm.
All those things I think are musts for practices. And
Hmm.
then, of course, there are the bells and whistles on a bunch of things that I don't know is necessarily practical for every practice or warranted for every practice, depending
Sure.
upon the size of that practice. But
Sure.
I think those mentioned are the minimum of really being able to create a great running office and
Hmm.
a great patient experience.
Yeah. Yeah, I mean, one that we interact with is just as on our side of the coin is reminders for appointments. I mean, our family dentist, I probably get four or five and I need them. I mean, it's already in my
Right.
calendar, but I don't know why, but I'm like, yeah, thanks. Text to confirm. That's the one thing I have to do. Fine. Even that's getting more standard, so now I know to look for that. Sometimes you'll see like the top half of the text in on your sleep screen on your phone. You're like, I don't need to read the rest, but you kind of do. So that's okay. Um, Reminders are a big deal. Like yeah, I mean, if you can't bill unless the patient shows up, right? So if you have
Right.
any sort of rate of no show, well then this makes a lot of sense, right? So wouldn't you say?
Absolutely. And I think the other part is when you're using these automations within your software programs, a lot of times you can pull reports. So you can get a lot of the metrics that you need to be able to
Mm,
managing your business properly, rather than if you have people manually calling people, well, how many people did they call? How long did it take?
yeah.
How many answered? How many called back, right? Now you've
Hmm.
created, going back to that, now you've created the 7-step manual process
Hmm.
that you could get in a click of a button if you're using automation for those types of things.
Right, right. And then to go back to the worrisome, so we've got like the global sort of what's AI going to look, or what's automation? I said AI, but they're sometimes used interchangeably. I think
Yeah.
that was my flub. I shouldn't have done that. But I mean, anything more like anything you're seeing out there going, I don't think that should be used yet, or that should be used very carefully.
Not that I'm seeing. And I mean, I would say in the years of embracing automation, there's always the systems down issue, right?
Hmm.
But you also have the internet's out issue, and we have some of those. But overall, you have less human error,
Yeah.
less double entries that could be incorrect.
Hmm.
And the system down is not a very common scenario that I've seen. It does happen, right? But a person could call out sick too. So,
Right.
you kind of have that. So I'm not seeing anything that really leaning towards the negative. I would say that most of what I'm seeing is very positive on the
Okay.
automation aspect. And I
Okay.
mean, I would also like to say we all, those of us that are business owners and, have staff members, recruitment and retention has become quite a challenge,
Hmm.
especially over the last few years.
Hmm.
And so, in surveys of people that leave um, employers or people that are looking for work, a lot of what they're looking for is culture's number one.
Hmm.
And also they want a work-life balance.
Hmm.
So if we can make their job easier,
Hmm.
our practice more effective,
Hmm.
and be able to put the people in front of people for that
Hmm.
rapport and that experience, it's a win-win-win if you ask me.
Mhm. And I was just going to add, this is a good segue. How do you advise practices to think about this, balance of people in tech, people in automation? I mean, as you were describing that, I was thinking, if I'm working in a job and I see an easier way to do something, and they say no, how come? Well, we just do it this way. There's not a good reason to be like, I don't get it. I mean, everything would be better, you know, downtime versus people, that sort of comparison you went through, or whatever it is. It's like, why can't we just do it the easier, better way? But how do you, coach them and to talk about balancing people and the people side of work versus the tech side of work?
So that's actually a great question. I think that people need to see the value in it.
Hmm.
And so by being able to provide examples of the value and how it's going to solve some of their pain points and their problems
Hmm.
is really where that's at, to get people to be willing to embrace this change and be able to. And I do the same thing with staff. So a lot of times staff members, they're like, we don't want change, we like it this way, we know it this way,
We
right?
know it this
but
way.
when
Yes.
but when I'm able to show them that you're saving 20 minutes, by embracing this and get them excited about that. A
Hmm.
lot of times, I mean, people are resistant to change in general,
Hmm.
but a lot of times when you can show them how this is going to improve patient experience, their job, their practice,
Hmm.
and the pain points that are keeping them up at night, how it's going to help eliminate those or solve those problems, then it's a no-brainer at that point,
Yeah.
right?
Do you have like a recent win you could talk about there, just to kind of give us an example of that?
Yes, actually. So a practice I was working with was spending an average of about 22 hours a week using a staff member to do financial clearance for patients. So basically
If I had that
authorizations
job,
and
I just feel like I'd want to shoot myself, but okay. That's
yes,
just me.
sitting on the phone on hold forever with
Oh,
insurance payers, trying to find out what this patient responsibility is going to be for this procedure or for this, office visit or this item or, whatever the case may be. So that was taking about 22 hours. We implemented a software that now takes less than 60 seconds to get that
Come on.
information
Wow.
for patients, obviously.
Sure. Okay.
So now we were able to basically utilize that FTE that was doing that to do more patient-centered care, and shift that financial clearance responsibility to another position, because or to a position that was already in place, right?
Mm-hmm.
Adding it to a position that's already in place and a process that's already in place.
Mm-hmm.
That because it takes minimal time. So you
Yeah.
just add it to part of, you know, when we're already in the system,
Right.
checking out or checking in or whatever the case may be, we just handle it at that point. So,
Right. And I
so
was going to ask
that
you
was
what,
a big win, big
yeah,
win.
and then what happened to the person who was spending 22 hours? They were reassigned, right?
Yeah, exactly. So then my philosophy is always, let's use our human people
Mm-hmm.
to handle the things that can't be automated, which generally is face to face with the patient,
Mm-hmm.
patient care, being able to put their shoes and socks on, or being able to provide that extra level of customer service, or whatever, they ask about their grandchildren,
Right.
those kind of things. And let's use automation to do all the things that the staff members would have their head down handling tasks anyway.
Right.
Okay?
Yeah. And, from the provider point of view, so all that stuff gets better, but you would get back to how hard is it to find good people these days? Well, you may not have to look for new people as often, right?
Right.
You can slow the rate that you need to find more people because you've offloaded these repetitive tasks to a program rather than a person, right?
Right. And, you don't have to hire as many people. And with the increase of wages and,
Yeah.
payroll taxes and such, what I'm finding is in many of the cases, these automation softwares, or a lot of times, like I said, maximizing the software you already have is so
Yeah.
underutilized. But if you have to buy something else that integrates with something, generally speaking, what I'm seeing is it is substantially less expensive than hiring a person to do this manual task.
Well, not only that, and this is going to sound poo-poo on people, I don't mean it to, but there's no payroll taxes on software. There's no
Right,
fringe benefits. There's no HR manual. There's no culture requirements. There's all this
right,
stuff that you need for people you don't need, you know?
right. Now, that being said, I don't think, automation or AI is going to take over people's jobs.
No, I don't either. I think
There,
there's a
there's
balance,
always,
right? So, I mean, if you're
there's a
ruthless and you
balance.
want to shrink headcount or whatever, then I suppose you could give it a shot, but there's a better
Right,
balance of, imagine a world where you could keep your headcount flat for a lot longer than you thought and everything is still getting done. And to continue down the path you've set, now that the people are happier, the patients are happier, there's more face time
right,
where it ought to be. Um, that's a nice outcome,
right.
and
Well,
doable.
and I would say, I mean, a private practice in healthcare that, say, has 7 to 10 employees, and reimbursement rates are not going up, but all these other costs are inflation of
Yeah,
product, of supplies, of wages and payroll. It's not, I
it's
mean,
not
it's not
sustainable.
sustainable.
Yeah.
It's not sustainable. So for the practice owners, it's really important to be maximizing the software that you already have and the automation
Hmm.
that's already available to you, so that you don't end up, you know, basically expensing yourself out of business.
Correct. Correct. And realizing, we're doing X this way when something we're already paying for could be doing it that way instead.
Exactly.
Yeah, that can't be a fun moment. When you find that out. Yeah,
Yeah.
absolutely.
Yeah.
Um, so when you think about the balance of people and automation, it's just if you had to kind of sum it up, how would you said it before, right? People for people things, I guess, and automation for I don't say non-people things. That feels too vague. How would you say it?
Well, I think for administrative,
Got it.
administrative functions. So, and any, tasks that are not necessarily people centered. And I think that, uh, it, it's, it's not only beneficial for a practice to embrace this, but patients like the convenience of not having to call to make an appointment at 8 o'clock
Mm-hmm.
at night. They realize, oh, I need to make a dentist appointment or whatever the case may be, right? And
Mm-hmm.
they're working all day long and they're busy. People are busy today.
Mm-hmm.
So being able to go on and just request an appointment online, or,
Mm-hmm.
be able to pay their bill online, or be able to cancel an appointment via text message because something came up, or reschedule via texting the office, right?
Mm-hmm.
Those kind of things are not just um, benefits to the practice themselves, but it also is adding to a great patient experience and convenience
Mm-hmm.
on the other side.
Mm-hmm. Which
So
competitively matters.
right, as a patient, I don't ever want to have to call your office and sit on hold
Yeah.
to make an appointment or to reschedule an appointment. And luckily, with a lot of places that I go, that's not the case because they have that automation.
Yeah, that's
Um,
true.
I find it very convenient that at 9 o'clock at night, when my day settles down and I forgot to ask my doctor a question or remembered something while I was there, that I can just shoot a message through the portal
Mm-hmm.
and the doctor will get back to me at their convenience.
Mm-hmm.
I mean, those kind of things, as a busy person myself, I find it adds to the experience of this whole healthcare relationship with my provider.
Yeah. Yeah, here in 2024, it's a reflex for people to say, usually justified, if the rest of the world can do X, why can't you? If I can text the rest of the world to live my life, why do I have to keep calling you? Why is it
Right,
slower and harder with you? People
right,
will tolerate it to a degree. But you're just making life harder on everybody, it seems, if you
right.
don't kind of catch
Exactly.
up. Yeah. Um,
Exactly.
we covered a lot of ground here in not too much time on what is a large topic. So um, I appreciate it. There's two questions I ask every guest to wrap up. First one is, in spite of the ground we covered, is there anything you think I should have asked you, but I just didn't think to ask you?
There's so much to cover on this
I know.
topic,
I
but
know.
I mean, no, I can't really say that. I think that pretty much, sums it up. I would say that, ultimately it's about working smarter and not harder and being able to invest in the relationships
Mhm.
with our patients and our staff members.
I actually have one that I just thought I should ask you.
Okay.
So your private practice X, and you're starting to realize this. Wow, we could be doing things differently or better. Now you've got to figure out eventually where can we do this? And so
Mm.
it's not a prelude to the next question. Um, my question is, should you try to do it yourself? Should you try to do it with your staff? Or should you just try to bring in somebody from the outside? And the reason I'm thinking of that is it's sort of the grim picture. If you and your staff, you are so in the weeds, everybody is so in the weeds. Can you see these opportunities or not? That's one. And then on top of it, some might want to protect the way it is. And so you don't get the full view, I guess. So what would you say to that?
Well, I mean, I think it depends on, again, going back to what you were saying, if you're in the weeds or if you have the time, right?
Mm-hmm.
So I think every practice owner situation is unique in regards to how much of an owner operator they are or how much
Mm-hmm.
of an owner they are of the practice. So
Yeah, true.
if you have more of an owner that's spending time looking at strategic plans or ideas or growth or those types of things, and they have that time, then by all means, I mean, you can get lost in Google world.
We're all guilty of
um
that.
yeah, and I mean, I would always say find out what someone else is doing that's working for them
Mm-hmm.
before going out there and just kind of trying to wing it on your own. If you're in the weeds and your staff are super busy and you're thinking something's got to change, but I don't know where to start, I mean, that's where someone like, a consultant comes in,
Mm-hmm.
or an advisor, or another practice mentor, or, someone that is out there seeing and is able to say, I've seen this software or this work or this not work or this work in this practice or this not work in this practice,
Mm-hmm.
rather than recreating the wheel,
Mm-hmm.
and somebody that's already done it and see what they've done that's,
Right.
been successful or not been
Right.
successful.
Right. 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 And maybe you answered the next question, which is imagine we've caught a listener's attention. They're saying, you know what, she's right. I need to get moving on this. Sometimes people get really enthusiastic about something, but they just don't know where to start. So
Mhm.
if you had to give them one or two super simple, actionable things they could do as soon as they're done listening to this to get started on this, what would you recommend they do?
Well, again, I mean, it kind of comes back to what I just mentioned in regards to, finding a mentor or reaching out to a mentor in the
Mm-hmm.
healthcare practice. If they have a successful friend they can sit down and have lunch with and,
Mm-hmm.
pick their brain, or finding a good consultant that can come in and help their practice, or a coach or something along those lines. Or like I said, if they have nothing but time on their hands, which I don't know
Mm-hmm.
many people that do, but then they can, go into the internet highway and start researching some things themselves, or asking their vendors.
I was just going to ask you about that. Like, why don't you sit down with a fresh look at your EHR and just go swimming in the tools library and see what they have. And, if something looks interesting to you, ask, so how do we do that today? Do we use this or do we do it some other way? And just start to, yeah, bring the vendor in. That's interesting.
Yeah. Well, and I mean, a lot of times the EHR systems or software systems will have kind of tutorial guides, or,
Hmm.
some type of education center where you can kind of research, can I do this on this
Hmm.
system? And if so, how?
Right. Excellent.
Hmm.
Cool. Um, this is great. I really appreciate it. This is, like I said, this is a pretty whirlwind tour. I wasn't sure. It's such a big topic. Some of the
It
topics we
is.
cover on different
We could
episodes are
probably
much
talk.
more granular and you can feel like you nailed it, but we hit a lot and not a lot of time. So thank you very much.
Absolutely. Thanks so
Yeah.
much for having me on, and I hope that this helps some of your listeners.
I'm sure it will. Thank you. And so you provided contact information for use, and we're going to get them into the show notes for the episode so that anybody who wants to
Okay.
contact you, yeah, now they've got another way to do it. 2 points before we wrap up this episode. First,
Okay.
if you are someone like Jolene or I and you serve private practice owners, or if you're a private practice owner yourself and you've got experience on the business side of private practice that you think others would benefit from, in either case, please, we want you to come on Practice Care and tell the world about it. In the show notes for Jolene's episode, in every episode, there's a link, super quick, easy, couple of questions. Tell us what's on your mind so we can get you scheduled as soon as possible. And finally, you got to subscribe to Practice Care. One word, search Practice Care. You will find us. We're everywhere. It's easy. We have a new episode every week. And really, the easiest way to stay up to date with them is to subscribe. So please do that right away. Thanks very much. Until next time.